I'm Maham Niazi, and my topic of research is the role of counseling in addressing family trauma. So, what is family trauma? Family trauma refers to distressing experiences or events that affect one or more members within a family unit. It causes lasting emotional consequences and relationship issues for those directly affected in the family. A lot of events and experiences can cause family trauma, and family members may react differently to these experiences. Here's some common causes of family trauma. All members of a family may react differently to the trauma experienced, but these are some of the reactions they may exhibit. However, it's important to remember that often family trauma has lasting impacts and can affect individuals anywhere from months to years later. Now, family therapy involves working with the significant others as well as the patient. In other words, it focuses on the relationships within which the patient's problems or behaviors are manifested. It's also called systemic therapy. Family therapy often involves a range of modalities to deal with the different levels of trauma and impact it's had. When addressing family trauma, the first line of action is usually individual counseling, which forms the foundation of trauma recovery, enabling each family member to process their unique experiences and emotional responses. Traumatic events often fragment a person's sense of self and distort cognitive and emotional functioning. Through trauma focused individual therapy, clients can reconstruct coherent narratives of their experiences, regulate overwhelming emotions, and identify maladaptive coping patterns. The second modality often used is family therapy, where it targets the relational patterns that sustain or conceal trauma within families. Drawing from systemic and structural approaches, it views trauma as not only an individual experience, but a disruption of the entire family system. Family therapy helps identify dysfunctional patterns such as scapegoating, secrecy, or role reversals, and replaces them with open communication and mutual empathy. Often, the third level of therapy involves group therapy, which introduces a powerful collective dimension to trauma recovery. By engaging with others who have undergone similar experiences, family members discover universality and validation, reducing their sense of isolation and shame. Group settings normalize emotional responses to trauma and foster hope through peer modeling of coping and resilience. Very often, the younger people in a family will have a different uh, caregiving system in terms of therapy, as children and adolescents do not respond to trauma in the same way as adults. They may exhibit isolation, behavioral changes, or regression. Play therapy is one of the treatments used, as play offers a language for children to express and resolve their internal conflicts. Art therapy allows adolescents, especially, to express themselves through art mediums like drawing, painting, or sculpture. Trauma focused cognitive behavioral therapy is also empirically supported and integrates cognitive behavioral and family components to treat PTSD and trauma related symptoms. One of the most formidable barriers to trauma is the cost of trauma therapy. Many evidence based modalities require multiple sessions and sometimes over months or years, which accrue substantial costs. Where mental health services are not well covered by insurance or public funding, families must either forego care or absorb the high out of pocket expenses. In many regions, especially rural or underserved urban zones, trauma specialists or mental health clinics may be few or concentrated in only urban centers, which renders consistent care impossible. Stigma and cultural perceptions are also a pervasive barrier. A lot of families may have a lot resistance towards family therapy because of cultural norms and interpretive frames. Though there are some strategies to mitigate these barriers, such as having systemic changes in funding reforms and policy, or offering telehealth and hybrid models to cut down on expenses. But I feel the most important is to have anti stigma campaigns and psychoeducation to allow social acceptance of family trauma therapy. Family trauma poses unique challenges to therapeutic intervention because of its relational, hidden, and systemic nature. The four categories of barriers accessibility and affordability, stigma, cultural perceptions, lack of trained professionals, and internal resistance within families each impose significant constraints on help seeking engagement and treatment efficacy. These barriers are interdependent and mutually reinforcing. Overcoming them requires coordinated action across policy, education, community engagement, and clinical training. And future research must address the complexity and layers of family trauma and therefore use all four modalities discussed to provide a holistic solution to families who have experienced trauma.